Hi, my name is Betty Jean, and I am a licensed professional counselor with the Mental Health Association in New Jersey. And it's my pleasure to be here with you today, and I'm so glad that you're joining me. This May is Mental Health Awareness Month, right? So in honor of Mental Health Awareness Month, we're spending the month just discussing and talking about healthy minds and healthy living. So today we wanted to really kind of take some time to just kind of take a look at the mental health professional field. They talk about mental health. Go see a counselor. Go see a therapist. Who does what? And I think it's important that you know exactly what a mental professional is, who they are, where they work, what they do, so that you can find the right person to address your mental health needs. So today, if you have your pen and paper ready, we're just going to be talking a little bit about the different mental health professionals and to see which one is the right fit for you. Now, there's many types of mental health professionals out there that can help you achieve your recovery goals. They work in various settings. They work in settings such as inpatient facilities. And inpatient simply means that you stay overnight. They provide you care. It's more extended stay. You could find an inpatient facility at a general hospital or even a psychiatric unit. Mental health professionals also work in outpatient facilities. What are outpatient facilities? Our outpatient facilities represent your community mental health clinics, mental health agencies, or even private practices where you'll find mental health professionals there to provide you care on a regular basis. Mental health professionals, their job titles are different. It's not always the same. They have different specialties. They have different treatment approaches, and they vary from state to state and from professional to professional. So the information I'll give you today, it could be different based on the state that you're in, but I'll give you a general synopsis of what it is that you should be looking for. I'm hoping today that I'll provide you with a guide to help you navigate your way to identifying the mental health professionals that's right for you. So let's get started. I divided this up into a way that could help you understand what these mental health professionals provide and what they don't provide. And you could always come back to this video and revisit it again if you're not clear. All right. Let's start here. Let's say you're looking for a mental health professional that provides medication and that provides med monitoring. Let's look at who provides medication and who provides medication management. All right. Sometimes, depending on your mental health needs, you may need medication. Who do you see for that? First and foremost, let me just say, if you are experiencing any symptoms that you're not sure of and you just sense that it's maybe mental health related, the first person that you should be contacting is your primary care physician. Right? So you want to see your primary care physician because many times mental health problems can actually be caused by physical conditions, right? And so if you see your medical provider first, or let's say if you have a family nurse practitioner that you see for your regular care, they can help identify what is a mental health condition, if it's connected to a physical condition, and once they rule out once they rule out a physical condition, they can help you identify what next steps to take. Do you need to see a psychiatrist? Do you need to see a counselor? But they should be the first professionals that you see to rule out anything. So don't jump the gun yet, all right? Just first go see your medical provider, your PCP, your primary physician, and have them do a general evaluation. There's certain medications for physical conditions that can cause mental upsets, mental challenges. So I want to encourage you to see your primary physician first, okay? If after seeing your primary physician, there is an issue, maybe your primary physician can refer you to a psychiatrist, all right? Who is a psychiatrist? A psychiatrist, along with your primary physician, can provide medication to you. A psychiatrist is a licensed medical doctor who can provide medication to help you with help you manage the symptoms of whatever your mental illness or whatever symptoms that you describe to the psychiatrist. So a psychiatrist works to prevent, diagnose, and treat mental illnesses. And as medical doctors, they are there to help differentiate mental health problems from underlying medical conditions. All right, so oftentimes a psychiatrist will prescribe medication, and they'll do some assessments, but you won't find that they provide therapy all the time. Oftentimes their main job is to provide medication, do assessments, and at times they may do therapy, but oftentimes you'll find psychiatrists referring out to other counselors, other licensed mental health professionals to assist you in counseling. So just keep that in mind, because oftentimes people just hear, I need a psychiatrist, not really understanding that a psychiatrist, their main job is to either provide medication, prescribe medication, do assessments, and further diagnoses, but they're not really big on providing therapy. All right, so the next lineup is those who provide assessment and therapy intervention, right? So there are psychiatrists, now there are psychologists. Now, psychologists, they also provide assessments, they also provide therapy, but they don't do prescriptions, they don't prescribe medication, right? So just those are the two P's in this field, psychiatrists and psychologists. But psychologists do not prescribe medication, so keep that in mind. But they do evaluate people's mental health, right? They do evaluate people's mental health. They hold doctoral degrees. You'll see their initials are either PhD or PsyD, and oftentimes, well, they have to be licensed in a particular state to work. They'll provide an assessment and evaluation using clinical interviews, psychological evaluations, and they are able to do testing as well. They make diagnoses and they provide therapy. The therapy could be individual or group, all right? So that's a psychologist or a clinical psychologist. Now, there are also what we call school psychologists, right? School psychologists, predominantly you'll find them working in an educational setting or educational environment. They do assessments and evaluations, but it's within the scope of educational planning, educational programming for students dealing with various issues such as learning difficulties, social difficulties, or mental health difficulties. Whatever it is, they're there within the school setting, within the educational setting, to provide guidance and support and counseling support to children, to students, and their parents. So those are psychologists. Psychologists, again, do not provide medication, but they do provide therapy and assessment. All right, moving on. We also have mental health professionals that provide counseling and assessments with proper training, and they also do not provide they don't provide medication. Now, these mental health professionals are master's level healthcare professionals. They're trained to evaluate person's mental health based on their training, because every mental health professional, licensed mental health professional, has different training and different background. They're able to diagnose, and they provide therapy and or individual group treatment as well. You can also hear them referred to as a counselor, a clinician, a mental health clinician, a therapist, a psychotherapist. You'll hear those terms referring to these master's level mental health care professionals. A mental health provider, a mental health professional can be a licensed professional counselor, which is what I am, with the acronym LPC at the end of their name. Another mental health professional can be a licensed marital and family therapist with the acronym LMFT, standing for licensed marital and family therapist. They predominantly work with relationships or marriages and families. There's also the licensed clinical alcohol and drug abuse counselor, with the acronym LCADC, right? All these three mental health professionals are master's level mental health professionals. They are able to do counseling. They can do assessments based on their training, but they don't provide medication. We also have licensed clinical social workers who also are licensed master's level clinicians, but they have an additional training where they are trained in case management and advocacy. So the licensed clinical social worker, their breadth of work is a lot larger at times than LPC, but all three represents master's level mental health workers or professionals. So if you are in need to see someone, most likely your psychiatrist will refer you to see a mental health professional who is licensed, such as an LPC or a LCSW, licensed clinical social worker, or LMFT. They'll refer you to continue to do your therapeutic work. And what they will do is that they will help you with coping skills. They will help to look at your symptoms, find out where they came from, and help you adapt, help you to cope, help you to make some changes that will help you to live more healthy and help you to manage the symptoms. Now, if it comes to the point where your therapy with these licensed mental health professionals, it needs some more support, your therapist, your counselor, your clinician could refer you to a psychiatrist, right? The psychiatrist will then prescribe you as needed medication that will assist you with your treatment course, that will assist you with your therapy. But medication is never meant for you to just take it alone. Medication is meant to be part of a treatment course, which includes therapy, individual or group, and medication, and all other healthy living methods that you need to employ in order to get better. So just keep that in mind as you think about how all of these steps work. There are other mental health professionals as well. There are social workers. Social workers are bachelor's level, BS or BA level social workers who help with, they provide case management. You'll find them in hospitals and inpatient hospitals where they help with discharge planning, and they link you with other support services in your community to help promote more healthy living. There are peer specialists. A lot of people have not heard of peer specialists, but there are also other mental health professionals that assist. Who are peer specialists? Peer specialists are counselors who have lived experience with a mental health or substance abuse condition, and they're trained to assist fellow peers with their recovery. Oftentimes they share their own story with the hopes of helping other fellow peers or others that are going through similar situations to just come out on the other side a little bit stronger with a lot more support. There are also CADCs, or Certified Alcohol and Drug Abuse Counselors, which are different from the LCADC, which is the Licensed Drug and Alcohol Counselor. CADCs don't necessarily have a master's degree, but they still receive training in alcohol and drug abuse, and they provide needed support to those who are in recovery. And lastly, there are pastoral counselors. There are many people through their local churches, through their local parishes. Their pastors provide counseling services. And what are pastoral counselors? Is their clergy that are trained in clinical pastoral education, and they're trained to diagnose and provide individual and group counseling. And everyone's skill set is different, but they're definitely a resource for you in your community if you're looking for mental health services. I presented to you just an array of mental health professionals and providers that are available to you to help you with your mental health needs, to help you with the difficult times you may be going through. But how now do you identify, where do you go to find mental health providers, mental health professionals? I'm glad that you asked. Definitely, if you have insurance, you can definitely go through your insurance provider to identify mental health professionals that are available in your insurance network. If not, you can also call our agency, contact New Jersey Mental Health Cares. We are our mental health provider and referral service, and we help connect people to mental health providers in their community based on their county. So if you are in the state of New Jersey, or even if you're outside of New Jersey, please give us a call at 1-866-202-HELP. 1-866-202-4357, and we could definitely assist you in locating mental health providers in your state or in your community. Once you have found or located one of these providers, whether it be a psychiatrist, a licensed professional counselor, a licensed clinical social worker, whoever it may be, the first thing you want to do is you want to call them and speak to them via the phone. You want to ask them some questions, right? When you're looking for a mental health professional and a mental health provider, you want to interview them too. All right, there's lots of questions to be asked. You know, what are some things that you want to ask? You want to ask them about their approach to working with people. What's their philosophy? What's their concentration? Do they have an area or specialty that they focus on? Do they focus more on children, women, adults, family? Do they focus on what specific experience in terms of depression do they have, or anxiety? You definitely want to ask them questions about insurance. How do they handle payments? You may also want to describe the reason for your calling. Why are you looking for an appointment at this time? You may also want to explain to them maybe some of the symptoms that you've been experiencing, so that you could get a sense for, are they a good fit for you? Have they dealt with people that are experiencing some of the symptoms that you're describing? After you've had that discussion with them, if you're comfortable, then you're ready to make an appointment. Once you make an appointment and you go in for your first visit, the professional will want to get to know more about you, and they'll want to gain a greater understanding of why it is that you're coming to see them. And they may ask you lots of questions. They may ask questions about the symptoms you've been experiencing, and you can just kind of explain to them what kind of symptoms you've been having. How long have you been having them? When did it begin? These are some of the questions they may ask. In this initial consultation meeting with your mental health professional, they may want to ask questions about your family history, your medical history, your mental health history. They may ask about what you do now. What do you do to relax? What do you do that you enjoy? What are some things that really trouble you? So all these questions that they're going to ask you is for the purpose of trying to better figure out how they can help you and what approach would be most helpful for you. After that first visit, there will be subsequent visits. Now, after the first few visits, you may not feel that there's a connection between you and the therapist. And I tell people all the time, your relationship with your therapist is like any other relationship. Sometimes it can work, sometimes it's not a good fit, but it's okay to discuss that with the therapist. It's important not to feel like you're hurting your therapist's feeling. You're not hurting a therapist's feeling. It's important because you and the mental health professional are a team. You're working together for you. So it's important that you let the therapist know that maybe it's not a fit, maybe the therapist is saying or doing something, or their approach isn't working with you. And it's important that you tell your therapist. And if it's not working, feel free to look for another therapist or another mental health provider that you really feel that you connect with. Because at the end of the day, the therapist, the mental health provider cannot do the work without you. You are the most important part, you're the most important person to the therapy process. So I encourage you to be honest with your therapist. Now, therapy is a lot of work. Some people have the idea that a therapist is there to give you advice and tell you what to do, and that's really not what a mental health professional is there for. They're really there to empower you and to help you live the best life that you want to live. So we are here to empower you, to help you make good decisions, and to help you live a healthy lifestyle. So this is all the information I have for you today. It's been my delight to just share with you about mental health professionals, and just to kind of get out of the maze that there is in the mental health system. And I recognize as a mental health provider that the mental health system can be confusing, but I hope that the information I shared with you today is helpful. And if you have any additional questions, please feel free to email me at bjeanbijan@mhnj.org, or you can go on our website at www.mhnj.org. Or you can leave comments below, and myself or one of our staff will get back to you and answer your questions and help you navigate toward finding your healthy living. So again, thank you for joining us. Thank you for joining the conversation today. And for more information about who we are as an organization and what we do, please follow us and like us on Facebook. You can also follow us on Twitter at MHNJ1, and there you'll find all up-to-date information, the latest happenings here at MHNJ. So again, thank you so much for joining us this month. Remember, May is Mental Health Awareness Month, where we're talking about, for the rest of the month, we're talking about healthy living for a healthy mind. So thanks again. Remember to be kind to yourself, and I'll be sure to see you again. Bye.